on the website. So it's 9:05. So I'm going to go ahead and get started. I'm sure we have all other things to do the rest of this beautiful Sunday morning. So I'm going to put a screen up to orient us. So this is just a quick reminder about HPIECE. And basically what we're trying to do with HPIECE is to come up with collaborative and interdisciplinary solutions for the social determinants of health problems we see day in and day out. So we're trying to take an expansive look at the community challenges around health and seeking resolution of disparities by, again, community-based and in particular interdisciplinary approaches. So in that vein, I'd like to introduce folks to Dr. Pedro Moreno, who's our first guest in this format. And Pedro is a friend of mine for many years. And at our last reflection session, which happened probably in early April, some questions came up about the situation with farm worker health and safety in this era of the COVID pandemic. So right away, I thought that, wow, it would be cool to have Dr. Pedro Moreno speak to us and inform us for our work, to help our work better, and if there's ways that we can make his work better. So briefly, Dr. Moreno co-leads the He will share with us how growers, physicians, researchers, politicians, top administrators, and farm worker advocates have joined forces to protect farm workers during this pandemic. And he'll inspire us with stories of resilience, hope, and generosity, the stories of farm workers, the real heroes in this pandemic. He reminds us of that again, the farm workers are the real heroes here in Monterey County in so many respects. To frame this a little better, I'm going to show you a quick statistic sheet. I'm going to try to show you a quick statistic sheet from my dashboard. Let's see if I can do that. Well, I might have to read it. Here it is. I'm still here. I just lost my cursor. Where is IT when you need it? So let's see. Here it is. I found my cursor again, and this is the data sheet I'd like to show you. So this is so far, even if you go to the Center for Farm Work, even if you go to the National Center for Farm Worker Health, they admit that the data is really rapidly evolving as regards COVID-19 and farm workers. So there are some caveats here, but this is what we know about Monterey County. As of April 27th, a data set will probably come out again tomorrow. But 183 positive tests for coronavirus countywide, 41 of those are agricultural workers. I've seen that percentage is greater than 25%. 113 of the cases are from Salinas, which is of course the highest density area in the county. And why population density is important, as you know, is that physical distancing is an important part of the solving of this dilemma. And then some demographic data about farm workers. 90,000, approximately 90,000 live in the region, according to the Pajaro Valley study. The Salinas Valley farm worker study from the same year had a higher number of 91,000 and change. And then interestingly, if you drill down on the farm workers, between 2013 and 2017, there's really been a push for this H-2A visa program. And the numbers in that 5-year period increased by 16 a multiple of 16. So we're, as of 2017, we were at 4,365 farm workers, and who knows what the number is now. Pedro may know a more accurate number of H-2 visa workers. And then an important reminder about the farm worker status is national figure shows that the average earnings are 17,500 per year. That's national data. I was paused, but I wanted to show this data sheet. Did you all have a chance to look at this data sheet while I was paused? Can you see the sheet?
Yep, can we look? I can.
Yeah.
Okay, there you go. I think a lot of this data everyone knows, but I think bullet point number 5 is really key in that this federal H-2A visa program is really increasing. Between 2013 and 2017, it increased by 16-fold, and there may even be more accurate data. This number of 4,365 was from 2017. Okay. So those things being said, I'm going to, let me start off by asking Pedro a couple of questions, and then we can open up for even more questions from the group. Altogether, I imagine we have about a half an hour format. So we're all here. Maybe Nathan will join us later, but let me start off, Pedro, with a question for you. Can you tell us all what you do in town? I read a little introduction on you earlier, but more informally, tell us what you do in town and how long you've been around.
Yeah, thank you, John, for inviting me to be here with you on a Sunday morning at 9 o'clock. First of all, before I talk about myself, I need to say this is not about me. This is about the farm workers. And I wish I could have some farm workers here telling the stories. They are the ones best than me. I've been privileged to work with you for years. And with work with some of the people who are now in the call, and Dr. Cushing, and Dr. Uchman, and his wife Nightingale, and all of those in your group who will be listening to this. And I have to be very humble. I have been very inspired by the work that you and all of you are doing in this group, in the health providers for equity, allyship, and community empowerment. And I have to recognize that that you have taught me, specifically John, through your example day after day, night after night, about how to be really involved in the community. And you're a mentor for me for many years. And I really look after you, and I hope one day I will be able to do what you are doing right now in housing advocacy and many other issues in the community.
Thank you, Pedro.
We have another doctor also with us, also Dr. Blair Cushing, who has also been, for me, an inspiration in the last few years. I met Dr. Cushing at Natividad Medical Center, and at that time she was going through her training. And I knew from the very first beginning that Dr. Cushing was someone that I could learn and be inspired by too. Her work as a social worker before and working in Boston was also inspiring me. So, and then of course, Dr. Uchman and his wife also have been also an inspiration for me. So again, I'm not an expert about this. I've had the fortune to have great mentors like all of you. And most important, have the privilege to work with farm workers in the Salinas Valley for the last 26 years. Here, there are stories of resilience, stories of strength, stories of generosity, and that's the reason why I'm here now.
Thank you for such nice words, and really for such humble leadership over the years. Pedro, what's the issue you'd like to share with us today?
So the issue that I want to share today is very simple. COVID-19 can be, we don't have a vaccine, we don't have medications, but we're going to defeat COVID-19 because the best medicine that we have right now is the community, the work that we are doing right now together to try to defeat this virus. And I have to say that as a physician, it's a very humble experience to realize that in the pandemic, you are powerless. But you're not hopeless, but you are powerless. And the only way that you can get some power, some strength, is by talking to your colleagues, talking to also other healthcare advocates, talking to, in my case, talking to the growers, the farm worker, talking to the academicians, professors in the schools, talking to the farm worker, the attorneys, and the unions also who protect them. And by talking to each other and staying at the same table, then we can find innovative solutions to this problem. So that's a message that I want to give, it is that together we can defeat COVID-19.
Yeah, that's so true, and that's really the intention of this space here. My follow-up question you've already answered. That is, why is your work and your approach important to HP's members? And as you and I have talked about on many times, the social determinants of work are so intertwined. Where people live, the work they do, the income they make, that to try to solve or to try to help positively in remedies is not going to happen in our offices, whether we're medical doctors, whether we're social workers, whether we're public health officials. You know, we're just going to, and the nature of the way business is done in America, we're only going to come up with solutions in our silo. So what you've been able to do in this project, your formation of this coalition, is really a remarkable example of crossing silo walls and being interdisciplinary. So my next question is going to be, what's your request of us? And I don't mean us just gathered here in this telephone meeting, but us, the multiple, I don't know, 250 HP's members, and then even beyond that, the people that we'll come in contact with over the next few weeks. And I phrase that question keeping in mind that I haven't given you yet a chance to talk about your coalition. So again, what's your request of us HP's members, and tell us about the work of your coalition, the gathering together of this great coalition to help with farm worker health in this pandemia era, and how can we help?
Yeah, I couldn't agree with you anymore. I think it takes a village to raise a child, and it takes a village to fight the pandemic. But it's not our village; it's the world village. And this is what we have done in our coalition. A few weeks ago, we got together. We've been thinking about this for a long time, but this was an opportunity that we had to make it happen. So what about if we sat at the table, the agricultural industry and the union, the United Farm Workers? They've always been fighting each other. Of course, they have different interests and different roles. What about if we also invite also the attorneys, the California Rural Legal Assistant, who have also advocated for farm workers, and they have always also fought very hard with the ag industry. And so, well, in the meantime, why don't we bring a mediator, physicians and professors of the university, and also bring also the health department leaders who are leading us, and bring the politicians. And it was obviously what needed to be done right now. Why don't we all sit together and we try to find out what is the common denominator? What do we want to accomplish right now? And it's clear what we want to accomplish right now is a win-win situation for everyone. We want farm workers to be able to be protected right now in the fields, to be able to have face masks, to practice social distancing. Make sure they wash their hands frequently. Make sure that if they go by bus, that they have at least 6 feet separation between each other. Make sure that if they are sick, they will be able to be referred to get diagnosed and be tested independently whether they have insurance or they don't have insurance. Make sure that those who are positive with COVID, they will have a place to isolate themselves if they cannot have a place in their homes. Since you know very well, our housing crisis is such that it's impossible for most of the farm workers to isolate themselves in a room if they are positive with COVID. So will they be able to have a hotel, a motel, a place where they can spend 2 weeks if they are diagnosed, so that way they don't transmit the infection to the rest of the family, especially to those grandparents who are living with them, who are the most vulnerable. So we had all those questions in mind, and we realized that as physicians, we want to also protect our healthcare system. We don't want to have all the beds in our ICU taken. We want to make sure that we are there for everyone, and we need to make everything possible to avoid, again, a large number of infections, especially in the farm worker community. So everyone wins. If we work together, if we find solutions to the problems that we are facing, the healthcare will be available to provide beds if you need them. If you are sick, the farm workers will be able to have a job and provide food that we can bring to the table. And most importantly, growers will be able to continue developing their businesses and make profits and be able to also feed the nation. So anyway, so that's what we are trying to do right now. Try to find what brings us together, not what separates us, but what brings us together, and try to find solutions. So in this coalition, we have done significantly remarkable things in this short time. For example, we have written a letter to the governor, all the physicians and growers together, requesting for face covers for the farm workers, which are very difficult to get. We have also written a letter to the governor, also requesting for more testing kits, so that way we can diagnose our farm workers. We have now developed also health education materials that we are trying to disseminate also among the farm workers about just basic information in not only in Spanish, but also in some of the languages that are tricky, mixteco, zapoteco. So that way they can understand why it's important right now to follow those measures to prevent the disease, and what to do also if they get sick. We have members of the coalition right now going to the fields to do education. We have Sally Tirado, who is the director of the community program at Natividad, and she's taking physicians in training, and just to the fields to talk to the mayordomos, to the foremen, to the farm workers about how to protect themselves, how to protect their families, what to do if they are sick. And those are, and most important, what we are doing in this coalition is we are trying to coordinate all the services that we need, social services, medical services, and so that way we can be more efficient. Let me tell you the example of Aaron Boyd, who is an attorney for this California Rural Legal Assistance. He has this in mind. He was telling me that, Pedro, how can we motivate and farm workers and help them understand that if they are sick and they have to be 2 weeks at home, and that's the right thing to do. They need an income, and they don't have sick leave from the federal government. So he said, let me try to find out how we can disseminate all the different programs that we have available right now for what's called income replacement. So we have this in California, we have the state disability, we have the paid family medical leave, and now thanks to our incredible governor, we have also sick leave for 2 weeks, even for undocumented workers. So again, we all know those things, but the important thing is how do we communicate those to those farm workers who don't know how to read or write, who don't know about those ideas. So that's also a very important part of the message that we are giving them. So basically, the message that we are giving the farm workers is that, number one, you aren't alone. You aren't alone. The physicians the growers, all the farm worker advocates are with you, number one. Number two is that the other message is that we are giving them is that if you trust us, if you trust all of us, we're going to help you navigate this complicated system that we have in place. The healthcare system, the social service system, the disability and income replacement system. So we'll be there, we'll be coaching you. The third thing that we are telling them is that it's okay to be fearful. We all are fearful, but it's important to realize that it's important to be also brave now. And we have to be brave, and we have to realize that if you get sick, and most of the farm workers in our community are young, they're in their 20s, they have children who are very young also too. And then the message is don't trust, don't watch TV. That's the message. Don't watch the news, because the news from New York, the news from Europe are not the news from Salinas. In Salinas, we have right now the latest news. We have a little more than 200 people with positive COVID. Out of those, we have 79 who are farm workers. And again, farm workers in general do well when they get sick with COVID, and they are sick for maybe a week, 10 days, and they recover and they go back to work. Their children do well also too. But we have to also remind them that we have to protect those farm workers who are either older or are sicker, who have diabetes, high blood pressure, heart disease, lung problems. Those are the ones that we have to put more strength and focus. Some of the things that we are doing, for example, many physicians, is we are encouraging those farm workers who are older or sick to stay home, and we try to provide a state disability to them, so that way they will have some type of income replacement while they are at home. We are trying to find also ways to recognize symptoms as soon as they happen, so that way they can seek medical care. Because as you know, there is significant fear because of the public charge rule and the chilling effect of the rule. There's significant fear still in many farm workers to seek medical care even when they are sick. So anyway, those messages are the ones that we are trying to give them day after day, and they need to be repeated, because it's difficult to, when you are in fear, it's very difficult, as you know, to listen. Fear is a very, very powerful emotion that really doesn't help in this time of crisis. And we are trying to show with our example that we physicians, we were also fearful at the beginning of this crisis. But we have made, right now, there are very few physicians in our system who are sick. We have protected ourselves. We have kept all those measures that we are suggesting them, the social distancing, wearing the face mask, and try to wash our hands. So all those things, we are doing them, and then we want to encourage them to do them too also. And I don't know, it's, if I want to summarize this crisis, I think this crisis has given us an opportunity, like all the crises in history, an opportunity to learn from each other, an opportunity to work together, an opportunity to be closer to our farm workers. And the hope that many of us have is that this opportunity will help in the future, once it's over, help us realize how important farm workers are in our communities. How much thankful we are for the work they've done now as essential workers, taking risks in the fields to provide food to the table. And most important, the things that need to be done to make sure that they have a living wage, they have also affordable housing, make sure that they have sick leave and all the benefits, and most important, that they're our brothers and sisters. They need to be this division of undocumented and documented, illegal and legal. That's something that is going to be part of history. I firmly believe that after this crisis, we will recognize that our brothers and sisters, the farm workers, our heroes, will be part of our families also too, with the same rights, the same benefits that every American has the privilege to have.
So thank you, Pedro. That was a very rich answer to that question, and so rich, I'm sure that this would probably be a good time to have some folks had questions. specifically for the territory that Pedro just covered with us? There was a lot there. This would be a good time to entertain those questions.
So Pedro, one of the things that you mentioned was with some of the more elder farm workers or people who have known chronic conditions that we're trying to protect and encourage to stay home. I'm just wondering how you've been managing that in practice in terms of, are you actually putting people out on disability so that they can get benefits, or utilizing FMLA? During the past month, I've kind of stepped away from primary care, almost like accidentally. I've just been in Texas for all of April and will be again for May. But I'm realizing that even when I come back, like, this is still going to be a thing, maybe, okay, we flattened the curve, but we're not done. It's going to continue to be there. And so how do we manage for some of those individuals moving forward? Because it's not tenable to say, okay, just don't work for 5 months or 6 months or however long this is going to continue to be an issue. So how are you managing that for those individuals? And then I guess, how are we going to determine, have we even thought about this yet? How would we determine when's appropriate for those individuals to return to work?
Yeah, that's an excellent question, Dr. Cushing. I think it's very difficult right now to do long-term planning. So my goal is make sure that my patients don't die in the next 2 or 3 months. And I have patients who have a decrease in immunity, who have rheumatoid arthritis. They are on immunosuppressant drugs that lower your immune system. And for them, I think it will be suicidal to go to the work, especially if they are going in a ride with other farm workers, especially if the children are going to a babysitter and mixing with other children and can get infected. Especially, and most important, if the grower is not providing safety measures. So all those variables, I think, you have to count upon. And so if a farm worker doesn't give me the reassurance that he will not be infected in this process, I try to educate them and give them the possibilities. So one of them is get the state disability. And all of them suffer from depression or anxiety or the diabetes or hypertension, and I use those codes as justification for the disability. And
you're just coding it on the known chronic illness. You're not like trying to utilize something about exposure to
COVID. I haven't used exposure to COVID right now, but I think the other issue is also I try to encourage them to use the food banks, the food stamps, and all the social benefits that we have available. So that way they have, if they don't have to spend money on food, the little money that they have, they can use it for rent. As you know, right now there is a moratorium right now on evictions. So if they cannot afford to pay for the rent, that's something that also is important to talk to them in the medical visit. But most important is you have to help them overcome fear. And the fear is so intense right now. It's not only fear to COVID, but what about if I get deported, if I apply for food stamps, or even if I go to the food banks? So you have to talk about all those issues and let them know that although we don't have all the answers now, but we are there with them. And once they know that you're on their side, that you are helping them the best you can, then they start trusting you and making those difficult decisions to stay home, have a lower income, but maximize all the resources in the community for food banks and food stamps, so that at least they can get by for 1 month or 2 months at a time. And then we will reevaluate the situation. I agree with you that this is not sustainable right now for anyone. But what about if in 3 months from now, let's say that some of those growers who are now doing overall a very good job in general overall, and most of them are not all of them are following those strict guidelines. What about if in 3 months from now the childcare situation has improved? What about in 3 months from now there is also new programs also at the state or even federal level that will help them? So I don't know. It's a good question that you ask, and now what I do is I live one day at a time.
So I have I'd like to kind of do a follow-up on that. you spoke really nicely, Pedro, about the primary prevention aspect, especially at the level of the farm worker. The twist I would like to put in the question is, you have agricultural employers at your table. And we've also read this week in the Coast Weekly, the Monterey County Weekly, that Grower Shipper Association has done some good work in getting nurses and medical residents out to the fields to do some preventive education there. So in particular, the Grower Shipper Association has been highlighted as being a very good collaborator. So my more specific question to you is, the ag employers you have at the table with you, can you tell me about their level of participation and understanding of their role in this? And then a follow-up to that would be the recommendations for employers to prevent COVID. Are they, I wonder if the agricultural employers are participating and are aware, and how they're using your help and advice.
Yeah, that's very interesting. I am very impressed with how the Grower Shipper Association and the Farm Bureau has responded to this crisis. And just on March 20th, soon after we had the stay-home orders, they have already developed guidelines. It's called the Agricultural Advisory to Protect Farm Work. And it's a 3-page guideline that describes exactly what growers need to do to protect farm workers. And it's one of the best guidelines that we have in the state at this point. Not only that they're excellent, but also they get updates every week. And they are asking us, physicians, to give them specific input about this. So the problem with those guidelines is that they are guidelines, they are voluntary. So as a consequence, a large number of growers follow them. And so specifically the social distance, the face, washing your hands, and make sure that you diagnose early farm workers with symptoms so you can prevent the rest of the crew to be infected. Again, all those guidelines are expensive from the growers. They have to implement new systems in place to that have a cost attached to it. In addition, that the ag industry is now having decreased income and decreased benefit and decreased market share because the restaurants are not taking their produce, among other things. So it's a difficult time for them, but they realize that they need to do this to protect their business. They need to do that to protect their labor workforce. So I have to say that the collaboration and the spirit of partnership is very strong. But by the same token, I have to also acknowledge that there are other growers, other companies, other contractors who are not following those guidelines, who are still packing farm workers in crowded buses every day, who are still not providing face covers, who are still not encouraging the social distancing. And unfortunately, there is no significant regulations at the county level. Right now, there's no enforcement of those guidelines, since they're voluntary, to try to encourage all those irresponsible growers to do their part. So right now, the ag industry, the way they are, at least locally here, the way they're trying to deal with this issue is by encouraging all those good growers who are following those guidelines and who are encouraging those guidelines. They are trying to talk to if we don't follow the rules. So it's we have hope that as the months start progressing, we will have more growers that are jumping and realizing that those guidelines need to be not voluntary, but they need to be really permanent. They need to be mandatory. And
So
hopefully,
in that vein, Do you have political partners? Do you have representatives in the coalition from, say, Robert Rivas's office or Luis Alejo's office or Jimmy Panetta's office?
Yeah, we have the supervisors, especially Luis Alejo and Chris Lopez, who have helped support the development of those guidelines. And we have the Henry Gonzalez, our Ag commissioner, also is part of those guidelines. But again, is that we don't have strong guidelines at the state level that are protecting farm workers. And the Cal OSHA, which is a state funded organization that protects that's job protection for all of us, including also farm workers, has published recently some guidelines, but unfortunately the guidelines, according to some experts, are not strong enough. They don't, especially in this time of a pandemic. And also it's difficult to enforce them too right now. So, so imagine that right now the guidelines that we have right now, for example, to stay home, for example, are not followed by all the citizens of Salinas. That some of them decide to, those are voluntary guidelines. So some of them, we're going to stay home, but some of us, we're going to go to the beach and we're going to have a party. So unfortunately, that's not the way that we are going to be able to survive this pandemic. We all have to take right now our belt. You're right. I think many people are still on denial, and many people are irresponsible right now. Many people are not taking these virus serious enough. And I think to send the same message to them over and over again, I think is important. But unfortunately, I think we will have to see some of those colleagues getting sick, and then once they get sick, and maybe some of us may get sick as a consequence, we will learn the lesson.
Right.
I mean, you know very well that we talk to patients over and over and over again about the importance to just follow certain lifestyle changes. How many times have you talked to a smoker to quit smoking? Fortunately, when he has lung cancer or he has a heart attack, that's when he quits smoking. So unfortunately, with some of our neighbors, we have to wait for them to get sick. Some of them will die. And then at that time, then I think the message will be more clear. I can't reinforce enough how important are those things right now. We know that we can flatten the curve if we follow those measures. But I think that first thing, the best thing that I'm doing myself is I'm telling my children who are out of the house, if you're going to come home and you're going to stay with me, you have to tell me in the last 2 weeks, have you been with a friend in the last 2 weeks? Have you been washing your hands in the last 2 weeks? Do you think there is a possibility to be positive? And if there's a possibility, I want you to be tested before you come home. So it's a matter of trust. I won't take a risk myself or my wife, who are already in our late 50s, to be sick just because even my own children and don't take responsibility. Fortunately, responsible, and they are following those guidelines. But I would say the same to anyone in my workplace. I know that some of my my medical assistants maybe are not as thorough as others, and for them, keep this 6 feet separation. And I try not to make sure that they understand why it's that important.
So hello, I'm back, folks. I lost my connection. I guess if I'm going to be doing more of this hosting, I have to go ahead and get an Xfinity. I was trying to delay that. But my question's about the politicians on your coalition, Pedro. Boy, it seems like Assemblyman Rivas is doing good work in this regard. And I understand that there's talk about a California relief bill for farm workers. And it will include many of the things that you've talked about tonight: expanded sick leave, supplemental hazard pay for farm workers, outreach efforts, even things like telehealth, and to get to rural areas like King City and San Ardo. He's even talking about, the bill that he's proposing is even talking about tax credits for farmers to help people. In particular, the way it's worded is to allow overtime work. It seems like he would be a useful resource. Additionally, with his history, I guess he grew up in a farm worker family. So if you need someone from the coalition, or need someone from his office on the coalition, I know Dominic, probably Blair knows Dominic as well, Dominic Dursa. He might be a useful person to get on board. And then a technical question is, how are you meeting? How is your coalition getting together during this? Because a lot of our community work, admittedly, is taking a step backwards now because of the shelter in place and wanting to respect the wellness of our colleagues, our community colleagues. How is your coalition getting together and talking? Is it conference calls? Is it video conferencing?
Yeah, so to answer your first question about Robert Rivas, I agree. We need to contact. We have been in touch with Ana Caballero, we Senator Bill Monin also too, and we want to expand also to other politicians, and we will be contacting them soon. So thank you for reminding us. He's a champion for farm workers, and we count on him on this time. And the way we meet is the same way that we meet. All of us meet now through Zoom, through the Zoom application.
Mm-hmm. And how often are you getting together?
We meet every Monday at 5 o'clock, and if any of your members of your own health providers for equity coalition wants to participate, and they can just contact you or contact me directly, and we will be happy to invite them. We have now 50 members who meet, and we usually listen, and we have them every week, and then we have questions, and then small working groups that try to work together too. So this coalition, hopefully, it will be a long-standing coalition that will protect farm workers now from COVID, and then after COVID is finished, we will keep protecting farm workers right now for maybe align with you for housing, and for, of course, for living wage, and for also healthcare.
So very good.
Dr. Pedro,
yeah, I was just about to introduce the Ukmans. So go for it, Nightingale.
okay, thank you. Hey, so I think the only person that I haven't met with in person is Dr. Cushing. So it's nice to meet you virtually. And by profession, I'm a registered nurse. And so coming into this discussion, one of my questions would be a very me-directed question on how you would utilize someone like me who has the bare minimum Spanish to be a participant in working directly with looking at the healthcare of the farm workers during this time. And also my other question would be just wondering how the childcare looks from your end, and if any work has been done around that, and what is in the works and what is missing right now. I'm curious about their education as well as their care while their parents are out working.
And yeah, thank you for your excellent questions. I know, Nightingale, that we are all called to serve now. Yeah, I think we can't afford to stay on the sidelines. It's impossible. Those who have a passion to serve, ready to serve. So much that can be done right now, even if you speak Spanish. Let me tell you, the needs are so intense right now. They are so important in the farm worker community that anyone can help. Anyone can help. If you want to come to the meeting tomorrow at 5 o'clock, you will have we can talk to you about some of the working groups we have right now. And everyone is welcome. We need help. We need help because we can't, everyone in the coalition is working, all the leaders. So we need a lot of things that need to be done. For example, and now Dr. Silva mentioned about contacting our elected officials. I would love you to be able to get on the phone because I don't have time from 8 to 5 to just call our Robert Rivas, and tell them about what we are doing. If you could do that and try to follow up, that will be so extremely helpful. Not only with Robert Rivas, we need to talk to our governor's team also, to our elected officials up in Sacramento, and let them know what we are doing, because unfortunately we are not publishing anything. We haven't had a chance to disseminate what we are doing, but that needs to be disseminated for two reasons. One is because I think these community efforts to deal with COVID, I think, need to be replicated in other counties, in other states. And number two is because we need more resources. And the only way that we will be able to respond to the needs that the farm workers have right now is if we have more human and economic resources. We need face covers. So if you could help us try to find face covers, for example, and at this time, that would be important. If you could help us also by trying to find ways to convince some of the farmers markets and also the food banks to stay open a little bit later. And because right now, they open at 4 o'clock, 4:30, they shut down. And that's when our farm workers come from working, and that's when we need them. We need a lot of help also to coordinate services. If you could help us by talking to all the different stakeholders and try to see how we can all learn about what we are doing and coordinate it. If you could talk, for example, to, I think some of the, for example, the United Farmer Workers, to the other groups who are also the Center for Health and Community Advocacy, the CCA, and basically you will be in a speakerphone that will be able to disseminate what we are doing to other stakeholders that need to come to the coalition. And then the other question that you had is about childcare. Childcare is one of the things that keeps me awake at night also too, because right now, and the stories that I hear from my patients is that they take their child before they go to work to this babysitter who happens to be a neighbor. But there is also maybe 5 or 6 other children who come from three different families, and they all stay there together. I mean, that's very risky at this time. So if we could educate the child care providers that maybe if you're going to take only one person and take one family and take it always the same family, that would be ideal. And if we could educate the child care providers about how to wash their hands frequently, how to make sure that if a child comes sick in that day that they don't take it, and no matter what, they send it back home. And to educate the child care providers that are doing this now at home, all these babysitters from the neighborhoods, that's also so important. Because many of us fear that this will, and the children will be also, right now, be vectors. We know that they're vectors, that they transmit the disease, they don't have any symptoms, but they are the ones who transfer the infection to their parents. And the child care is a very, very difficult situation right now. And what I'm doing with families who are working in the fields, I try to encourage the mom to stay home and don't go to work. And not only they're going to save the child care cost, which is very expensive, by the way, especially if they have several children, but also they will be able to, if they stay home, will be able to go to the food banks and get food. They will be able to go to the school to get food. And they will be able to monitor the children also and doing their homework. And again, sometimes if the mother has, for example, certain medical conditions, even fear, anxiety, I try to use that as a justification to apply for state disability income. So it's a matter of just help them understand that at this point, sometimes it's not safe to go to the fields, and for both parents, one of them is to stay home.
So
And this is even more important, in John, if, as I said before to Dr. Cushing, if one of those parents is sick, has diabetes that is not well controlled, high blood pressure that is not well controlled, has asthma that is not well controlled, or is a little bit older. So in that situation, that whether it's a man or a woman, that person needs to stay home. And the partner, if he's working in the fields, they need to drive by themselves, if possible, not ride with anyone else, and they need to follow those protective guidelines, and just by the rule, by the book. They cannot afford to take any risks.
So over at your place of work, the Alisal Health Center, have you providers there been offering state disability applications or state disability benefits, or encouraging
we have
farm workers? And are the diagnoses that we're describing, are they going to be covered by the state disability program? Like you'll say respiratory tract infection, and then your secondary diagnosis will be exposure to COVID, say. Is the state responsible for those for disability payments?
So let me tell you what the state has responded. Yes, before COVID. We had also, through our medical legal partnership, big victory with the state. Now, every farm worker, woman who is pregnant, and is going to go to work in the fields, and we can disable them as soon as they come to the clinic with a positive pregnancy test. And the codes that we are using is exposure to pesticides.
Mm-hmm.
So now there is no reason for a farm worker women to be exposed to pesticides right now. So basically, all our pregnant in the clinic, which are probably close to 500, I think, a year, they get disabled, no questions asked. So I cannot promise you exposure to COVID right now will work, because right now we haven't had those conversations with the state disability, but we will have those conversations with them in the near future, and we'll try to use the same reasoning and the same justification that we had for pesticides.
I mean, my understanding on that is that for the people who are actually being disabled as a result of being sick from COVID, it's working. The ones I'm worried about are the ones that need that more prolonged leave, because we know that they're high risk. Is that claim eventually going to get denied, because now it's been more than a month and the expectation is that you should be back. So that's, I think like time's going to tell how they treat those claims.
Yeah, I think our legal...
Back to what you were saying about the pregnancy claims though, I'm just wondering, because in my experience, since you told me that, I've been trying to encourage women that, I can disable you at any time if you work in the field, even the packing plants, because I feel like it's still a high level of exposure. But I have a lot of the patients kind of push back on it, saying that like they want to keep going because they feel like they can earn more money, and they can, than being on the disability. I'm just wondering if you have that experience as well.
Yeah. Obviously, when you need to eat and you need to pay the rent, those are the priorities. And the ones that we are more successful are those who, number one, maybe they had children, so if they stay home, they can provide childcare, so they save the childcare. And those who have known of someone who would have children with autism, attention deficit and hyperactive disorder, or learning disabilities. So once they know that this worker who children, and we know that the pesticides are really this strong association between pesticides and all those issues, then they listen more frequently too. And if they are, for example, from indigenous communities, from Oaxaca, for them to understand, and because they're used to work in the fields since they were children. And so I agree there is many roadblocks that right now to implementing this protection against pesticides. But I think we have made significant improvements. Now all our physicians are providing disability, no questions asked. Most of the mothers are applying for disability. And we have a great group of social workers who are also in trying to solve all the difficulties in roadblocks that we find in the process, which are sometimes significant. They have to call the State Disability Office in Sacramento and clarify things, they send papers. So it's labor intensive, but it's worthwhile.
So the question about coverage, SDI, state disability insurance coverage for COVID exposure, it seems to me like that would fit in nicely with any proposed state relief bill that was about to come about. And in fact, if you look at Rivas's, Assemblyman Rivas's page, he talks about supplemental hazard pay to cover out of work expenses. So it would seem like some education to his staff about what we've just been talking would be a beneficial way to get this onto the docket for some legislative vote in California. Couple of final things, because it's been almost an hour. One is, I don't know, I haven't heard from Nathan. I see him here. Do you have have you had a chance to ask a question of Pedro, Nathan?
Well, working on the mute thing. Yeah, thanks, John, and thanks, Pedro. Good to see you, Blair. So I'm interested in next steps and sustainability about this alliance. And I know, Pedro, you touched on that some, and it sounds like there's a lot of potential, and that it seems like it's off to a good start. And I know whenever we came about 3 years ago, we heard from various people that there's a history that is maybe a little bit divided or competitive between the different stakeholders advocating for community development and community needs. So I'm hopeful that this is part of the shift towards collaboration and representative diversity, focusing on the most marginalized members of the community. So just briefly, an invitation, what is going to be an ongoing and longer conversation is really just linking climate change and climate justice to this question. There's a big grant through the Robert Wood Johnson Foundation that I'll be happy to share more, but we're looking at trying to submit a proposal for the grants for the Central Coast, looking at both Monterey and Santa Cruz counties. It focuses on linking health, equity, and climate change. But what you do is specifically look internationally and find that we can borrow from something that's being done in another place around the world, and that we try and bring it to our US city. And so we have ideas about really looking at places in Africa that take a community-centered approach to linking human, animal, and environmental health, and that is essential for effective infectious disease surveillance. And it's also necessary for people to come together to promote resiliency in the face of climate change and the gross inequities. So we're looking at doing a stakeholder mapping and building on existing initiatives. And so I see a lot of potential to at least initiate a conversation with groups such as the Alliance and really construct a big tent to bring together the stakeholders involved in health, equity, and climate change. And that this would hopefully be something that would be for the long term and bring diverse people together to really serve the community. So thanks for the chance to share those ideas. And in case of any thoughts, happy to hear, but I know we're at time also. Thanks.
Thank you, Nathan. Can I make a comment, John, about that?
Sure, go ahead.
Yeah, so the pandemics that we have right now is obviously COVID. We have the pandemic of fear, and then we have the pandemic of poverty. But the pandemic that we've had for a long time that we haven't recognized is the pandemic of climate change. And all those things, poverty, fear, climate change, and COVID, are affecting our world right now. And hopefully this will be an eye-opener for us. COVID has waken us to realize that we need to respond to those questions, and we need to respond now. I agree.
So yeah, like I say, we all have things to do. It's so early Sunday morning, the sun is starting to come out. So what I really enjoyed was your description of the coalition, the goals being, you know, it takes a village, the goals being worker safety, which means food safety in this situation, healthcare for COVID individuals, COVID ill individuals, improving that, uh, access to care was another thing that your coalition was hoping to address. And finally, you talked about sort of the rightful use of medical resources. The more we can do up front, the more that the coalition can do up front in terms of prevention will keep hospitals and clinics functioning the way they should be for the rest of the care they have to do. So those are very, very global and noble set of intentions your coalition has. And it would be great if you could extend an invitation to HP's members. And I forwarded here, people are starting to put their email in. There may be evidence for more broad input into the coalition. And not only that, networking for opportunities for us to serve our communities better if we could be part of this coalition. So thanks so much, Pedro, for sharing your work with us. It really is an exemplary effort that you've done in getting disparate partners together on a very important effort. And my hope, as I know yours is too, is that COVID-19 should be a temporary situation. Who knows how long temporary is, but this work for farm worker health justice and resolution of health inequities for that vulnerable population, that's a lifelong undertaking, as you and I have shown, a many-decade undertaking. And I must admit that only through efforts like you've demonstrated in the last couple of months do I feel like sustainable progress is being made. So you've given us a platform, a sort of a diving board off of which future projects will just flourish. So thank you so much.
I agree, John, and I just want to finish by humbly say that this is not, again, I started saying this word, but this is not about me. This is about our farm workers, and I hope we can keep focusing on them. They haven't had a voice for generations. Now they have a voice that is loud and clear. The Washington Post, the New York Times, the Atlantic Magazine, PBS, they are all right now focusing on them, our heroes in this pandemic. So I encourage everyone to, number one, thank a farm worker when you see them. And number two, thank the grocery workers also when you go there too, because they're also our heroes. And number three, most important, take care of yourselves. And take care of yourselves, not only from COVID, but also we have to be resilient. We have to pace ourselves in this marathon. And we need to make sure that we do whatever it takes to take care of our souls, take care of our families, and realize that this is about us too also.
Okay, well, thanks, Pedro.
Quick question. I know we're at time, but I was very curious to know if at all whatever Dr. Pedro was doing with the farm workers, taking them out into the wild or into the environment, is something that's kind of in the works, because I know there's still some parks that are open or some spaces like in Carmel Valley, and just wondering if that's ongoing and we can continue another time after a brief response.
Housing is medicine, food is medicine, and nature is medicine. And I encourage everyone to do it. It's starting for ourselves. Hug a tree. We can still hug trees. We don't have to keep social distance with trees. Try to listen to the beautiful birds singing the symphonies when you walk in the and look at the mountains from top, and then see the valleys in below, and realize how lucky we are to live in this such a beautiful part of the country. So yes, let nature heal yourself. I agree.
Now is the time where we need to be planting cilantro seeds and basil seeds and parsley seeds, right?
It is.
That's a start. So once again, thanks everyone for your participation, these tremendous questions and thoughts and insights you brought to the team, to Pedro and my work with HPs. And get on out today and enjoy the sunlight, and let this discussion encourage and inform the work of this week that we have to do. So goodbye, y'all.
Thank you. Bye.
Good day. Thank you all.
Bye-bye now.
See you soon, Blair. See you soon, Nathan.
Bye. Thank you.
Nothing else.
See you soon.
Next, we have team 30.